Welcome, everyone. If I haven't met you before, you haven't been on a live, my name's Dr. Alysia. I've been doing these lives like every Friday, just because I really want this community to, as it grows. I mean, I literally just saw today it's at like 13K, which is insane. That's really insane for me to think about. But I want it to get more interactive. Like, I want to be just yeah, like, I wanna do live Q&As, like, I want to answer your guys' questions on literally anything. I feel like that was my goal anyways in creating this community, was to, like, give people the information that I felt like I didn't have. Um, as a doctor in the medical system, like, I felt like I was learning everything outside of that, so, yeah, like, I created this community for that. And so, yeah, I just think it's really important for it to continue to grow in a way that feels like really transparent and like it's actually serving the people that are within it. Um, I've done a complete overhaul of my website because, um, well, I just like, I guess as things grow, like, which I feel like you guys can tell me if this, resonates with you. But, like, as it's grown, my intention for creating this space has changed. When I first started the apothecary, it was all about herbs and, like, natural holistic ways to heal women's health problems, and that's still a part of it. I have gone through my own internal, like, identity reconfiguring over this last year and a half. So when I started this, it was like a little more than a year ago. And I was such a different person. Like, I was, the woman with her apothecary herbs, and I was working in residency, and I was just so unregulated generally. I was struggling with a lot of autoimmune conditions. I was just feeling really neglected by the healthcare system and by myself. And this became my like sanctuary, my outlet. This was where I, you know, put my curiosity into a actual living, breathing organism. And it didn't yeah, like, it didn't start for to be this kind of, like, platform that has all of these things kind of going on with it, like life and health and skincare, and now I do more with, like, the biochemistry stuff that I do, and this is just where I'm at right now, you know? So I feel like probably if you started subscribing a year and a half ago, you were probably like, "Okay, like, this is gonna be only herbs." Like, obviously, it's called an apothecary, but as it's grown, like, and I've grown, I've realized personally I need more than herbs in my apothecary. Like, apothecary is really just a bracket term for your toolkit, right? So, back in the day, that was herbs, that was that, but medicine is also part of that toolkit. Technology now is becoming a part of that toolkit. Um, just education is a part of that toolkit. So, I think as I've changed in my understanding of my own health, the Black woman's apothecary has really changed in alignment with that. And so I yeah, I don't know, I feel really passionate about, like, where it's going now, and I kind of wanted to talk about that a little because I do feel like probably a lot of you came here because you were interested in herbs, which herbs will still obviously be very present because I love herbs. I mean, I'm drinking a dandelion root, uh, coffee right now, you know? So, like, those are always gonna be present because I feel like women's health is neglected in a lot of ways, and herbs are one of those ways that we bridge some of that neglect. But I feel like what confuses people is that I also have a really strong, um draw to like women's health technology and where women's health is going. And I think a lot of that came from my time in public health. If you don't know, I got my public health degree in the middle of med school. I took like a break from it. It was during COVID, and I just decided to go um, learn about some of the problems I was seeing, mainly because I became really obsessed with like epigenetics and childhood trauma from like a spiritual sense, like in my own life. And so when I went to public health school, it was to learn more about those things. And in doing so, I learned about myself that I'm someone who needs innovation. Like, I'm someone who needs to see like efficiency. I need to see things moving forward. Like, I just need to see things changing because it really depresses me or like gets me down or it just makes me feel like not authentic when I'm in environments that like aren't moving things forward. And I feel like for me, that really speaks to what my experience was like in residency as a medical doctor. And it was this environment where I just felt like, I was in a small town in California. And even though I had chosen this residency because it was specifically like coded as a residency that was more advanced, like more forward thinking. I was able to use herbs with my patients and things like that. They were still really behind. Like we were still using, the same primary care medicine my dad just had a situation with the primary care medicine. Like it is not meant to prevent conditions. It is not meant to support at the root women's health. It's just not built that way. And even though the research is there for women to have the support they need, whether it's through herbs, whether it's through technology, whether it's through education, uh, the primary care system still isn't built around it. So even though like these systems, I'm not here to just like say that they're bad because they're not all bad. Like we need the healthcare system, and I know we're going through really intense remodeling right now with the economy and healthcare and all those things. So the systems might look really different in the next 5 to 10 years, which is exciting, I think, but also at the same time, like there are elements of those systems that we do need. Um, and I say all of this and explain all of this to say I am someone who needs to see forward movement. And because of that, I am obsessed with herbs and learning about the ways that these simple things can help prevent things. But I'm also really into women's health technology and where that's going, because that is what is actually going to be bridging the gaps in care that we see now, whether that's with endometriosis or fibroids or um, menstrual cramps, like the list goes on because there's uh, so many neglected diagnoses that women get that can be avoided, that we have research on that, where the root of them are and the pathophysiology of them. And technically that would lead us to believe that there are ways that we could prevent them. But because the healthcare system just takes so long to evolve, I believe that technology. Oh, someone said, oh, Nakia, thank you for speaking back. I love the exchange. Okay, so she said, I relate to some of what you're saying. Instead of matriculating into med school in 2020, I changed my mind and took time off to work. Today, I'm halfway through my MSW MPH dual degree program. Amazing, honestly, because we need people who, have a passion for health and the body and understanding the body that are going to change some of the ways that we relate to it, and are going to change some of the systems at play, which I feel like is what public health degrees teach you. They teach you that the system is the issue, right? The system is not built to support women's health. The system is not built to support preventive health. So I feel like that's why, for me, women's health technology has become so important. Like, I mean, things that are coming out right now, there's an endometriosis symptom tracker app that essentially is decreasing the time of diagnosing endometriosis by 7 years. Okay. Like, it takes 10 years on average to diagnose endometriosis because honestly, most physicians, uh, like, what's the word? Uh, like, the red flags don't go up for endometriosis in the way that they should because it's so much more common than we think it is. And now there's a symptom tracker for that. And that is literally decreasing diagnosis time by 7 years, which is amazing. And that's technology, you know? Or I think about like seed funding that just happened for the woman who created Kind Body, which is that infertility clinic that was ahead of its time when it was created. It made freezing your eggs, getting an understanding of your fertility accessible to the layperson. And now she's creating an app that is also going to use AI essentially to educate you on those infertility conditions like endometriosis, fibroids, things like that. Um, so I just think all of these things just go hand in hand. And so this is so good. And so I say all of that to say, like, the apothecary is going to continue to go in the direction of where do we all need the most support? Like, by all, I mean women. Like, where do women need the most support? And for me, I've identified that within myself, within, the people I see, the clients that I have, um, all of that, the direction that we're going in is kind of in these specific pillars for me. One of them being, you know, what does preventive care look like? Like, what does it look like to live a lifestyle that is preventing certain conditions? How do herbs have a role in that? How does food have a role in that? How does a lifestyle, just all of the things you do in your day to day life have a role in that? How does, your emotional experiences, your relational experiences, how do those affect your health on the day to day? That's one area. The second area being innovation. Like, how are we going to bridge some of the gaps in women's care? Like, PCOS obviously is like being diagnosed at 10 times the rate it was 10 years ago, which honestly, in my opinion, it probably existed still 10 years ago, but now we're diagnosing it more. And so, what do people do when they get diagnosed? Do they immediately go on birth control? To mitigate those symptoms, which is what primary care is doing? Or do we target the actual cause of the PCOS, which is the glucose situation, So it's like that is the juice of where I think the apothecary is going to continue to go, which is just like these are the questions that I have and the questions that I would have wanted answered if a lot of this stuff existed. Beyond that, you know, as a biochemist, I'm someone who just and by biochemist I mean like I essentially got my biochemistry degree before I went to medical school. So I've always had like this really interesting dynamic relationship with understanding the materials that are in products. I first was like really obsessed with skincare from a young age because I just had so much acne when I was younger. Like I had these huge, like, just cystic acne. I mean, it really was so traumatizing, and I had it from high school through college. And because of that, I am constantly looking at and dissecting what's in a product, what that does in the product, what's the actual like chemical reaction that has with the other things in the product, and is this something that's going to support my skin or is it just kind of like fake news, like is it actually going to do what it's saying it's going to do? And so I've had enough people in my life that have just basically asked me to do that for them. Like they'll send me a picture of the back of their products and just be like, what is this stuff? Which like essentially an esthetician could be trained to do as well. They would look at it from a different perspective. But like when I'm looking at it from a clinical perspective. I'm looking at it from a hormone perspective. I'm looking at it from a like actual like biochemical, like what is the reaction happening in my skin from this product? Like, uh, I did a biochemical analysis on one of the Say blushes, the Dew blush the other day, which I only use pretty much clean products. So even though I'm doing this, like if you guys want me to start incorporating some of the products that have like worse stuff in them, I can always do that. I won't use them, which means that I can't attest to how they work or things like that, but I can always give you guys a breakdown of what's in them. Um, but yeah, so I did the Dew Blush last week, and it was really interesting to learn that within that product, you're not just getting, there's certain things you need for like a cream blush. You need like glycerin in it because that's going to help to kind of coat the skin. That's also a moisturizer. So like a lot of cream blushes don't use that. Have to hop, but I love. Oh, thank you. Thank you for being here. Thank you so much. Um, but yeah, so there's certain things that a cream blush naturally would have, but some of the things that this Say blush has are like also things that can really support your skin. So at the baseline level, they're not something that on their own are going to do a lot, but it's still cool to see that within that product, you're getting skincare with your the base foundation of what the product is doing for you. So I think that that's just really important to say because one of the things that we're constantly doing is I feel like at the end of the day, we just want like our life to be simpler. We want, our routines to be simpler. We want them to work and we want them to, not cause issues. So for me, looking at products that aren't going to be hormone dysregulators is really important. Um, and I just like to share that stuff. Like I think that enough people in my life ask me to do that for them that I'm like, okay, I just feel like maybe I should just do this for everyone. Um, which is also why I started doing the skin consultations because I mean, if I could count the number of free skin consultations I would do just on the side for like my doctor friends or like my family, friend, like just like literally everyone comes to me because they know that I struggled with acne really severely and that, my understanding of skin is so deep because it's not just for me the what's on top, it's everything that's going inside your body. It's the biochemical reaction that's happening with your skin. It's, the product you're using, yes, but it's also like what's going on with your hormones, what's going on with your gut, eczema is a gut eczema. Like that's something that I think even dermatologists haven't fully grasped the like density that the eczema research wise is related to your gut. So I say all of that to say, like, these things are relevant in terms of how we create the routines and the patterns and uh, the daily habits in our lives. And I feel like for me, these are things that I just naturally do that, yeah, I just feel like most people ask me to do anyways. So I'm just giving that to you guys as a support. Um, And it's just fun, like, it's just fun to, like, pick up a product at Sephora and look at the back of it and be like, "Oh, shit, that does that, that does that, that does this." Like, "Okay, is this product actually gonna work for me? Probably not. Let me put it back. Let me go look at this other product." Like and it's just I think the piece around education for me is, like, always gonna be a pillar because whether it's women's health, whether it's your skincare, whether it's your beauty routine, educate yourself on what is actually happening here and how to actually support yourself. So yeah, so I did open up 2 consultations. One of them is already taken actually, so there's only 1 left, but I'll be doing those maybe for this month, and then I'll see how I feel. I think for most people who have followed this platform, you know that, uh doing in-person consultations was not my vibe. Like, that's that's a story for a different day. But skincare is one thing that I will 100% always love, like, helping one-on-one with because it's just so dynamic and there's so many elements to it, and everyone's skin is so different, and the reason that you're having acne is so different. I mean, I wrote the post the other day on your hormonal acne might be related to a histamine imbalance, which, like, that came up because one of my friends was going through some really significant acne for the past couple of years, and she had seen a naturopathic, like, acne specialist person and had done this, like, whole overhaul for, like, a year and, like, was paying, honestly, like, thousands of dollars a month to see this woman, and her acne really didn't get that much better, and then I, like, finally she 'cause I personally, I have learned not to give advice until someone asks me, like, I am someone with a lot of knowledge that maybe the average person doesn't necessarily have because I'm just naturally a curious person. So I just hold a lot of information and I also remember a lot of things. Like if you've like, I don't know, like I'm just that type of doctor. Like I just like things just like stick, like especially things that are interesting to me, which like skincare is always interesting to me. So I just things just stick. And she finally like opened up the space for me to tell her what I thought was going on. And immediately I was like, "Girl, your products are too intense," first off. Like, she had been doing, like, microneedling, like, once a month or something, and I was like, "Girl, your skin barrier is, like, completely fucked right now. Like, you need to start you need to start, like, giving your skin back some nourishment and stop trying to strip the acne away," because at the root, like, acne, we know is, like, essentially just, like, your your natural skin is basically just trying to defend itself with acne. Like, that is what is happening. It is holding on to oils, holding on to sebum because it feels attacked in some way, whether it's by your hormones, by your routine, your products that you're using, by, you know, your gut, whatever, you know? So it's and essentially like acne is an immune response. So when you think about it like that, you do not want to be very aggressive with your skin. Like, I feel like this was something that it took me a long time to learn because I feel like, I grew up in the 2000s where proactive was like the fucking thing, you know? So, like, through college, I remember trying to use proactive. And then finally, I had met an esthetician and she was like, what are you doing? Like, this is too aggressive. This is too intense for your skin. In a day and age where people still get prescribed Accutane and retinol that's over 0.025 and they're under, you know, 35 years old, like I'm just like, okay, we're doing too much, we're being too aggressive, you know? And at a certain point, like that aggression starts to backfire. Like maybe at first you start to notice that you have less acne, but like, essentially, as your skin recalibrates, as it gets used to the harsh product, it's gonna start producing more oils, and then you're gonna get acne again, but it's gonna look different. And so you kinda get tricked into this dynamic that's like, just like throw more at it and do more intense things, and it's just like, don't do that, okay? Like, please, honey, don't do that. All that to say, we simplified her skincare routine, products, and then I was like, she's someone who has a lot of allergies and also has migraines, and I was like, "Girl, this is histamine, like, your acne is coming from a histamine, imbalance," which a lot of people don't realize, and definitely physicians will not talk to you about this, but histamine, which related to, mast cell it's called MCAS, mast cell activation syndrome, which is like the bigger bracket term for it. But histamine itself is something that we all have. Like we all have histamine in our mast cells. And some people have a destabilized form of it that maybe don't have the enzyme that can get rid of it as much. And so then you get the people who have like elevated amounts of histamine. And because of that, you get these reactions like I wrote about in today's or yesterday's post, which is, you get the migraines, you get the endometriosis, you get the hormonal acne, you get more things than that. I mean, there's so much now that is related to histamines. But one of the things that obviously I like to work with is how histamines can cause acne, because it's like the most hidden thing in the world, and honestly, most dermatologists won't look for it. They'll just give you, the retinol and send you on your way, but at the root, like, there's something else going on, and you kind of wanna target that. So, all that to say, acne is a multifaceted situation, and it requires a multifaceted approach, which is why I decided, okay, like, I'm doing this enough for, like, my family and friends, like, I can open up a couple spots for people in my community to just, you know, have a session or two, we regulate your skin, we figure out what's at the root of your acne, and then you go on your merry way and you don't have to see me again. Like, that's the goal. The goal is to just teach you about your skin and how it works and what your problems are so that you can, you know, do this yourself and you don't need me. Um, but yeah, so okay. I've been chatty. It's been like 30 minutes. I've been nonstop talking. Does anyone have any questions about anything? You can drop it in the chat. Anything that I've written, anything in general about your health or your skin or your beauty products. I mean, I am an open book and I will share whatever, or I can just keep talking, one or the other. I'll give it like 2 minutes and see if anyone writes anything. Don't be shy. I mean, most of us, like, I feel like it's always been like whoever asks a question, a lot of people want the answer to it. So that's at least what I've noticed in the other lives. Mhm. Oof, this is funny. Ooh, what are some brands you recommend? Brands, for skincare or for what's happening? Sorry, I don't know what just happened. Mm, okay, okay, there we go. Okay, skincare, got it. Yeah, so, I mean, what's interesting is that you can really use whatever brand you want. It really comes down to what's in the product. So, for me, what I've found is, some products and brands that tend to have better ingredients are gonna be a the pharmacy brand. If you're someone who has, dark spots and things like that, the pharmacy, brightener with the TXA is gonna be the best for black skin specifically. And then if you've got like a lighter complexion, then I would say you would want to go with like a vitamin C for dark spots. Um, my favorite vitamin C is going to be Marie Veronique, which is a very expensive one and it's not necessary, but you can also get the Kiehl's one, which is actually has pretty clean ingredients in it, which I don't always say Kiehl's because Kiehl's, you have to be very careful. They are not always clean. What else? I really love Innisfree, which is that like green and white brand at Sephora. They have like some of the best products I think I've seen on the market. I mean, I don't know who is formulating their skincare. I honestly would love to talk to whatever dermatologist is on their medical advisory board because the products are just so amazing. I'll be posting. If you don't already follow me on Instagram, I do a product breakdown on Instagram as well. That's a little bit more simple and digestible. Um, but their hyaluronic green tea cream is probably one of the best creams that I've used for my face. It doesn't clog your pores. It's 5 different hyaluronic acids. So basically, when they do that, they're changing the molecular weight of the hyaluronic acid. So molecular weight being like, you have like a barrier essentially. And when you have like bigger compounds, they can't go all the way down into the other barrier, other skin layers. And so you want to change the molecular weight because then you get one at this layer, one at that layer, one at this layer, and they get stuck there. So they've managed to do that technology, and that moisturizer is amazing. They also have a gentle retinol that is really good that I really love. Other skincare brands that I really like, Edam is really good. Lessie is really great. Those are both BIPOC owned, which I'm always usually looking for a BIPOC to own first. And then if I can't find it in that, then I'll go to a different brand. I like Elta MD's skincare or their SPF. There's so many more brands. I'm sorry. Did I answer your question? I could talk for days about brands probably because there's just so many good ones, and I've tried so many of them because it's just I'm just constantly curious and like what is the ingredient in it and what is it going to do? So I'm lucky that I've stabilized my skin with like my gut, my immune system, my hormones enough that I can do that and test out products and figure out, what ingredients work best for me, which ones don't. And then usually that is what will work for other people as well. Um, what's another favorite brand? I mean, I love Living Libations, but though that's like a very specific skincare brand. Like you're not going to find your normal things there because essentially the root of what their formulations are is going to be essential oils. And so you get these essential oil blends and use them for specific reasons. My favorite's the sea buckthorn for acne prone skin. But yeah, so they're a really good brand. I love Monastery. And I love the owner of Monastery. She's an esthetician and she's really, really good. Um, yeah, yeah. I hope I answered your question. Are there any more questions? Oh, I see something here. Okay, I have an autoimmune condition, Sjögren's disease. Okay, I'm sorry to hear that. Autoimmune is hard, and I have issues with my skin being sensitive to a lot of random things. I thought I was allergic to everything and couldn't even use unscented soap, but the testing didn't show that. It showed that after blood testing, I had Sjögren's. But my question is, what type of body cleaners and moisturizers are good for someone who has mm, yeah. Okay. Okay, lovely. Yeah, definitely follow my energy. Okay, I'm so sorry to hear that for you. Sjögren's is really complicated. Nena, I hope I'm saying your name right. You can tell me if I'm saying it wrong. But autoimmunity is really interesting because you're not just talking about the outer layer when you're talking about why things are causing the reactions that they're causing. You're talking about your immune system being in a state of constant inflammation. And so when you're looking at products to use, you have to look at what in that product could possibly lead to more inflammation in your body, essentially. And so things that are really drying, things that are have like acids in them, things that are honestly not oil-based, like, everything you're gonna find over the counter mostly is gonna be something you shouldn't use, like, things like Method and, like, those kinds of cleansers, anything with, like, a fragrance in it, I would stay away from. Fragrance in general messes with your hormones, and then the messing with your hormones essentially messes with your immune system, so just stay away from any of that stuff. You want pretty much the most basic cleansers you can get. The first 2 that come to mind for me are gonna be the Osea, um, very simple seaweed cleanser, very clean ingredients, honestly formulated for people who have sensitive skin. Your sensitivity, though, I honestly it's it's different because it's not the same as someone who just casually has sensitive skin. Like, your sensitivity comes from your body essentially thinking that it's being attacked, and so it's attacking it. feels like it's being attacked by you, and so it's attacking itself, if that makes sense. And so it's a different type of sensitivity, and you essentially have to like control for everything that could confuse it. And so it really comes down to even more than your body care products. It could be your any sort of like fragrance you're using. It could be uh the emollient you're using, which is like whatever oil you're putting on top. So it can be a pretty loaded question. I think starting with Osea's uh body cleanser, or if you want kind of a cheaper alternative, the Naturium oil cleanser is very clean, doesn't have fragrance in it. And it's hydrating, which at the end of the day, hydrating is going to be more important to you than cleansing, because the excess cleansing, like the excess stripping of the oils on your skin, are what's going to cause that inflammation to kind of bubble up. So I hope I answered your question. Uh, if the skin consultation isn't booked yet, this would be a really good example of something that would be really supportive, because it's a very specific, you've got a very specific um, condition that honestly requires just a lot of attention to what are in ingredients, essentially. So the biochemical analyses that I do, I think actually will be really supportive for you, because I talk about in there people with like autoimmune conditions, like sensitive skin, which we can put you under the category of, but like I just explained, it's a different type of sensitivity. Um, and you're going to want to pay attention to products that essentially have this like anti-inflammatory and um, just like less stripping. Like you do not want to strip your skin at all. You just want to kind of do the gentlest cleansing you could possibly do. I mean, Cetaphil, that's what I'm talking about, like ceramides, like just generally not stripping the skin. Um, I hope that helped. Thank you. It helped. Yeah, it sucks. I feel like I have no sense of anything, and I loved perfume. I know, I know. I loved perfumes. I loved um essential oils. I mean, I was your essential oil girl, okay? Like I would put them on all the time. But autoimmunity, man, it'll really change your life. Like it is one of the most humbling experiences ever to experience your body uh essentially attacking yourself. And honestly, I would be really interested to hear like what the circumstances were that you developed this autoimmune. I was thinking about doing specific consultations for just people with autoimmunity, because I just have such a like tender place in my heart for it. It is such a specific experience, and I feel like not enough doctors who are treating someone with an autoimmune condition really talk about how all of the other factors in your life are possibly contributing to what's happening. And so, yeah, I was thinking about opening up appointments for specifically for people with autoimmune conditions, because again, that's like I suffered from it. It's one of my passions now. It's just like helping people with those conditions. So maybe in the future there will be space for more than skincare. We could do like I was thinking also like hair loss, because that's something that I just get asked a lot about too. Like, I mean, I went through my own hair loss journey, which was autoimmune that caused my hair loss, but because I had just learned everything, now I know everything about hair loss pretty much that you could possibly think about. Um, but thank you so much for your question, and I hope that helps. It's such a hard experience. Are there any other questions? Um, don't be shy. Like genuinely, I will answer whatever, because I just love to talk. Clearly, I could genuinely just talk about nothing all day. I feel like that's low key what I do on my Instagram. But okay, I don't see any more questions. I'll give it maybe like one more minute if someone wants to pop something through. And if not, we will just close it out. Um, uh, let's see. Okay. I don't see anything. All right. Well, thank you so much for joining me. Like I said, I think it might not be there anymore, but the last time I checked earlier today, there was still one more consultation. So if you feel like your skin is thoughts on natural skincare. Oh, so many thoughts on natural skincare. I mean, I could go on and on about natural skincare personally, like using honey, using coffee in solutions, aloe, things like that. So you have only 2 openings this month. If those aren't available, will you be doing any in April? I'm going to see how this month goes. Um, I'm going to see how this month goes, and if it feels like something that is supportive to my community here and on Instagram, then I will continue probably to have them. I don't know how long I will continue to have them, so they're definitely gonna be, um, few and far between just because I'm doing, like, so much, I swear. And I'm really, in this phase of my life, really trying to be sensitive to my nervous system, not taking on too much. And, I'm an intricate, detail-oriented person. So when I take on like a skin consultation, I'm not just working in that like hour and a half that we're talking. Oh, what are some places that I can find? Sorry. Okay. Yeah, you're right. I didn't answer the first question. Sorry about that. Okay. The second question, yes, there will be 2 openings this month. I'm gonna see how it goes. If the time of the second opening doesn't work, then you can always message me and I can possibly shift it around. Um, but I'm not sure if I'm going to have this again in April. I'm gonna have to see how these 2 go, essentially, and, if they still feel aligned. Okay, so then Angel's question was, what are some places to find recipes for skincare? Okay, so natural skincare is it's interesting because sometimes it can be really harsh, and you have to be careful with what natural ingredients you're using because sometimes they can be really supportive, like Manuka honey as like a face mask. You can literally just use Manuka honey as like a literal hydrating, glowing facial mask. You can use or not caffeine, but like grounded coffee in a mask that you already have that's like more nourishing, and that's one of the masks that my mom is absolutely obsessed with. She essentially will take her leftover ground coffee and put it in, like, one of her favorite masks, and add, like, aloe vera, which is a very cooling effect. I don't know of a lot of places that post specific recipes. I can always start incorporating some of that more because it's something that I do on my own. It's something that my mom has always taught me, essentially, or like, what are these natural ingredients going to do for your skin? Because she's someone who like doesn't wear makeup, even she's like 65 now. I've never seen a wrinkle on her face. Like, but she also drinks like so much bone broth and like fasts on it. So I do not recommend fasting personally for people of childbearing age, but um, yeah, so and then also there's an element of natural skincare, I think, that is like eating your skincare, which I was gonna post an article on. I think I posted an Instagram on it, but maybe I'll post an article too. Essentially, everything that I eat to support my skin. I mean, this morning I had sardines and a purple potato, and I feel like most people would be like, ew, what the fuck? But for me, like, I'm eating the sardines because I want the dense amount of omega 3s to fill in the little gaps that I have in my skin from maybe a pimple that I had. Because when we're eating the things that are essentially being incorporated into the reactions that create our skin layers. And biochemically, you need to have the ingredients in order to create that stuff, whether it's collagen, hyaluronic acid, omega-3s, all these things that are getting incorporated into your skin layer, you need to be eating in order to utilize. Because if you don't have them, if you literally don't have access to the cofactors and the what's the word? What's the word? Reactors that you need to like be in the mechanism that you need to formulate something, you can't do that process. So it's really important to like eat your skincare. That's something that I can post. I don't know. I used to follow this girl on Instagram. I don't remember what her name was. I think it was Jamie Skin. And she posts some natural skincare recipes. But she also uses some products that I personally wouldn't use because they're, uh, I don't know, like they're not as natural. So I don't know. It's hard to say. So do I, but I'm vegan. Yeah, that's hard. That's hard. Vegan is hard. Um, Vegan is hard for sure. It's not impossible. A lot of the things that you eat to nourish your skin are veggies and things like that, but the really dense stuff is obviously you're getting like collagen and things like that from. But like seaweed is a really good one. That is a skin superfood. Seaweed, uh, even doing like seaweed masks, um, really good. Aloe vera. What else? What else do I just like casually cover? Eggs. Eggs are really good. The cholesterol in the eggs. Um, yeah. So I mean, I can always start. I was writing up an essay on the coffee mask my mom does. And my brain, I don't know. I do not have ADHD, but sometimes I wonder because I, it's almost like I just keep 30 tabs open on my brain. And when my heart feels called to finish it, it finishes it, but the tab is open. So I do have the tab open to write that coffee recipe down. It just hasn't happened yet. So maybe this will give me the motivation to do it. I just need some information from my mom first because she's the one who made the recipe. Okay. I hope I answered everyone's questions. Thank you so much for asking them. As you can see, I could literally talk all day. I'm just going through to make sure I didn't miss anything. And I don't think I did. Okay, if no one else has a question, I will finally stop talking and let you guys enjoy the rest of your Friday. Um, oh, what was I gonna say? Oh, I did start doing a weekly tip thing that I've been hearing back from people and they're really loving. And it's like essentially every Sunday, I'll just give you one of my like research back tips that I essentially use in my daily routines. Um, and most of these are going to be things your doctor either doesn't have time to tell you or doesn't know about. And both are sad because they're things that can really benefit your life and really benefited mine. So I'm doing that. I'm doing the product analyses. I'm also very open to anyone who has a product that they're interested in learning about. You can send it to me and I will do a product analysis on that product because that's generally what I do for my friends and my family anyways. So yeah, feel free to send me products like in my messaging. What else? Yeah, that's where we're going. I've got an essay coming out soon on red light therapy and how to use it and what the research says about that. That'll be coming out sometime soon. And then I've got um I've got my beauty routine coming out next week. So the makeup products I use that are all clean. And if you follow me on Instagram, I've actually been experimenting a lot with makeup lately because I went 6 years of my life wearing the exact same products, which I literally had, I'm not kidding, like 3 makeup products. Like I had a concealer, I had a BB cream, and I had mascara. And that was it for 6 years because I was on this whole only skin, no makeup, just vibe, like low maintenance vibe. And now that I'm in this new phase, I'm seeing why people are obsessed with Sephora. Like, Sephora is like Toys R Us for adults. Like, I feel like how I felt when I was 10 going into Toys R Us when I go into Sephora. So there will be like my current beauty routine that I'm doing, like, you know, if I'm just like going out for the day, like those are the products I'll use. And I've researched all the products anyways. So a little bit of that will be included on there. And then also the things that I stay away from. So if you are looking up something for yourself, you'll see on the breakdown next week what I would not get a product with. Um, Acne prone skin, sensitive skin. Yeah, you want to stay away from that stuff. Autoimmunity, hormone issues, stay away from this stuff. And then I'm posting also like makeup reviews and things like that on my Instagram. So it'll go like hand in hand. Usually what I talk about on here, I'll talk about on my Instagram that week as well. So just a double dose of me if you want. Okay. I don't see any more questions. So enjoy your Friday. Thank you so much for joining, and I will be back next Friday. Bye.